Ask the Messengers, the program that deals with substance abuse, real people telling real stories. Hosted by Pastor Lester Lewis, co-host Charlize Wilkerson and Leroy Carey. Where there is addiction, there is a chance for recovery. We're trying to help save lives on Ask the Messengers.
I got sober when I was younger, in 2001, which I now look at as a sort of a JV version of what really the problem is. I was sober for a couple of years, and then I thought, I want to just drink like a normal person, and I want to have wine at dinner and so on. And I was able to. I was able to for about 8 years. I started to drink more and more and more, and it was really hard for me to accept that meant I was an alcoholic. I was like, I can just go back. I was fine before. I just need to take a break. I just need to slow down. I'm okay. This isn't me. And I started to drink every day. When I come home from work and I start to drink, and I just sit there and drink till I pass out on the couch.
April is Alcohol Awareness Month, and today on Ask the Messengers, our guest host Lauren Stovall goes one-on-one with one of her dear friends as they talk about alcoholism and recovery. Plus, real people share real stories about their addiction to alcohol. Also on this episode, salute to the frontliners in recovery. Our street reporter Lashon Battle goes one-on-one using the technology of Zoom, and we just hear the stories of the first responders, those who are on the front lines, still out there in the battlefields, helping those who are still suffering and trying to find their way to recovery. The Ask the Messengers TV show begins now.
Good evening. My name is Lauren Stovall. I work with the National Council of Alcoholism and Drug Dependency, which for short is called NCADD. So it's a national organization, and we are the Greater Detroit Area Chapter. So I have here this evening with me a good friend of mine, Ronald Perts, and he's going to introduce himself. And what we're going to do is really kind of share how Ronald and I became friends and how we met. So I met Ronald through the Salvation Army. Ronald, how long ago was that?
That was 5 years ago that I was into the Salvation Army through a reflection piece of my own. It also was through the court system when I had some difficulty in my household, and I chose, and I'm going to use the word chose, I chose to let the alcohol be my guide as to how I handle things. Through your classes, through Salvation Army, they gave me time to sit back, reflect, and to absolutely understand where I had come from, where I was, and where I wanted to be.
I want to stop you there because I want to have you backtrack. I want you to talk a little bit. I want to kind of tell a story, and I want you to talk a little bit about your life prior to going into the Salvation Army, where I met you.
I am a lifelong Detroiter, 65 years of age, went through Detroit Public Schools, began working with Detroit Public Schools as a teacher, a math teacher, a math specialist, an assistant principal, a principal, and ultimately working in central office.
So that was your professional life.
That was my professional life.
What was like that personal life like?
The personal life is where the alcohol and the stress that I call it, the fake stress I'm going to say, took its toll. I came from a middle-class family. I did not come from any bad surroundings. I had a mother who worked as a school teacher. I had a father who worked at the post office. I have two brothers and sisters who are very successful in life, and I had a family around me. I had a support system, but getting into alcohol seemed to be the downfall. There are things that people say that you have triggers, but when you look through the different lens of alcoholism, you see things different than you do. I am so very clear now. I am 5 years sober. It is a very wonderful feeling. I have no regrets about going through what I went through. But there's two things, Lauren, that I would like to express to the viewers and how we can get ourselves out of this mess. There are two things. One, you either have to see rock bottom or you have to hit rock bottom. If you can see rock bottom, then alcoholics, we are a very intelligent crew. We will make up any excuse and for us to get out of not taking a drink. But when you hit rock bottom and you have nowhere else to go, then that's when the other two pieces, your support system, my family, your program, and God, the spiritual.
Lamar, what was your drug of choice?
Alcohol was.
So how old were you when you first picked up alcohol?
Probably 10 or 12, maybe. Somewhere in that range. I was young. I snuck it. But that was about that time, yeah.
So when you drink alcohol, how do it make you feel?
At the time, during that time, it wasn't really nothing. It was like, I didn't know what to feel. I was young, so it was like, whatever. But as I got older and the more I got with it, just I felt fun, just relaxed or whatever. Wasn't me going crazy or nothing.
Have you ever overdosed off of alcohol? When I say overdosed, I mean like blackouts.
Yes, I have. I've done that a couple times, with like hanging at parties or whatever. So yeah.
What was that experience like?
Can't remember.
Was it enough for you to stop?
Enough for me to stop. What you mean, like to go back to it or? No, I just kept doing it. Like I was hanging and I'd do more and more. I didn't think it was a problem at the time.
So when did you know you had hit bottom? When did you say, look, enough is enough, I'm done, I need some help?
It was one time, like during before my sobriety, it was like I was dealing with heartbreak and dealing with just life. So it was like I just kept drinking. I would get up early, drink, and just nobody really knew. I was like a functional. I just held it to myself, but then I realized I had a problem. It was like I got home like after a party. I think it was my cousin's birthday party. I won't say their name. But I just woke up and I was like, man, it's just time for something different. Like I don't even know how I got home. I'm like, I drove home. So I was like, that's not safe. It's just something I need to just change. That's what I felt.
So what's your clean date?
My clean date is June 7th, 2015.
So did you get clean through treatment, on your own, church? How was it for you?
Cold turkey. I did it myself. Like I said, I woke up that day, looked in the mirror, and I was super skinny at the time because I gained a little weight, But it was like I looked in the mirror and I was like, I didn't like the person I was looking at.
I really don't want my children to pay for my sins. For me, seeing my dad he was drunk every day, and that was just life. And as that got worse, that was really, really painful. And I always said, that'll never be me. I'm never going to do that. I wish he had been sober during those formative years, but what he's taught me is how important it is for me to be sober now during these formative years for my kids.
I want you to look in the camera and give some young man or young lady a hope shot that might be out there thinking about picking up some alcohol for the first time, thinking that it's the way of life or it's something to do to have fun. Get them a hope shot.
Well, I would say this. If you're thinking to drink or any other drug or whatever, but drinking, you don't have to do it. Don't be peer pressured into doing it because of friends, because that could get you started, because that's what got me started. So just don't be afraid to just turn it down, and don't feel like you a punk because you didn't want to drink.
We are at war with a virus, and healthcare troops and first responders are on the front line fighting it every day. Let's join the fight by staying home. Staying home is not a retreat. It's the most brave and aggressive weapon we have against this enemy. Because when we do stay at home, we help prevent overwhelming our hospitals while buying time for our scientists to find the vaccine. And that is how we beat it.
Hi, this is your street reporter, Lashon Battle, coming to you from the comforts of my own home, quarantine. Today, we're going to talk to some of the heroes on the front line in recovery that social media do not talk about. We're going to hear some of their stories, what it's like working with the community on the front lines in recovery, trying to help people to continue to get help for mental illness and substance abuse. Today on Ask the Messenger, we're going to hear from Lynn Smith, George Arnold, and Eleanor Belford. We're going to start with Lynn. What's your story, Lynn?
My name is Lynn Smith, and my story is I'm a grateful recovering addict, and that I started this journey in 2014, April the 8th. On this journey, that when I stayed and I wanted to start helping others because they told me my old dreams would arise, so I started recovery coaching. And when I started coaching, I started working with men first in Bay City and Saginaw. A recovery coach is a person like myself that's in long-term recovery that share their experience. They're not a therapist and they're not a sponsor. They help them with resources and help other recovering addicts that want to stay in this process a new way to live.
Now working on the front line with people with this coronavirus going around. What is that like?
Right now, in the treatment setting with this COVID-19, that a lot of clients are fearful, a lot of anxiety, and afraid for their lives, even in being in treatment. This is what I'm seeing on a daily basis. But what they don't want to do is face reality, and I have to let them know this is a part of life right now.
Are they accepting people into treatment?
We still accepting people into treatment, but they're getting screened first. If they coming from the jails or wherever they coming from, we doing what the hospitals are doing. Make sure we checking their temperatures. Are you having any of them symptoms? They're coughing, hard of breathing, those kind of things, and fever. So we are checking. We are checking for that. And that if they do have those symptoms, we are turning them around. But we are letting people in because we still want to save people's lives. And I'm glad that you asked me to be on here, because on social media, I hear so much about firemen, the police, things of that nature. But I wrote a statement and say, what about the people that work in substance abuse treatment, inpatient and outpatient? We ain't getting no kudos. And we putting our life on the line every day. The social workers, the case managers, peer support, the monitors. I just have to remember that we here too. And we be fighting for our life. We still get up every morning to go to work. Yes, I have a note on my car saying that I can travel during this, and that it still be scary, but I have to remember somebody helped me. And this too shall pass. We just do the necessary things.
Yes. Thank you for sharing your experience with us.
Mm-hmm.
What's it like for you, Eleanor?
My name is Eleanor. So I come at a different angle, I think, a little bit sometimes, because I don't work inpatient. I am working for a mental health provider where we treat outpatient with substance abuse and mental health. So it's been difficult. It's been challenging because we're not able to have the face-to-face, hands-on contact. However, we're accumulating computers and laptops and things like that. But I've noticed that even in this process, my members are yet struggling. I just had a phone call a couple hours ago. One of my members are struggling, without the consistent services. I think it's just something about the hands-on, the face-to-face, I could touch your arm, and that feeling of knowing that it's going to be okay. It's been a challenge getting them their injections, because if you don't treat the mental health and the substance abuse, then there's still going to be a problem. A lot of times we self-medicate because of the trauma that we're experiencing mentally.
What are like some of the precautions that you all take when you have to be face-to-face with one of your patients?
So our agency, fortunately, has got a shipment of face masks from Korea. So we are able to have a face mask. They've given us some hazmat covers and gloves so that when we're going to the clients' homes, because some of them I have to help deliver food to, or I have some elderly members that I need to consistently check on because they don't have anybody else. We are their support. We're their family. So they're giving us hazmat, like a garment that the nurses are wearing. They give us the face mask, and then we have gloves. So when we go out, and they recently, a Detroit store just donated us about 4 cases of hand sanitizer they made for us. So we go out, we spray down, put the hazmat on, get in our car, see the member, kind of like stand in the house. We do a screening. We have to constantly ask our clients every day. The same thing what Ms. Smith was saying about, are you coughing? Do you experiencing a fever? We asked them, have you traveled outside, in the past 2 weeks? And then now we're asking them about their underlying conditions, because we're noticing that a lot of people have been tested positive and they don't have a fever. So we've been asking them, they've given us additional questions to ask, and who's their primary care provider, and connecting them to their primary care provider. So it's been a challenge. It's been stressful. I just lost 2 of my members this morning, and they found one dead in the house and the other one died in the hospital. So it's been a struggle. It's been a challenge, but this is, the bigger picture is that I'm still out here and I want to help. Because somebody helped me when the conditions wasn't well. I don't think we've ever experienced anything like this. However, I make sure I do self-care, and then in return, I'm able to give them the care that they need.
Thank you. What about you, George Arnold?
I've had the privilege of working with the other 2 individuals you spoke with, and I don't really look at it as being much on the front line. I actually never really think of it because people are dying. I've actually helped transport some people to the hospital, to treatment. I try to take all the precautions, and I know it's risky. I spray down and all of that, but the overall thing is it's not really much that I think about. I was blessed to come into this process. This is just a battle for all Americans. That's all I can say. There's heroes all over the place. This is a pandemic that's sitting on top of an epidemic. The heroin and opiate crisis that was going on, the pandemic just fell right on top of it. So we'll keep doing we'll be doing this long after COVID-19 is gone.
Won't you help us to do exactly what our motto is, and that is to help save lives? Won't you send a generous donation to the information there on the screen? We would love to have you as part of our partnership to help save lives. You may not be able to go out in the street, you may not be able to come here to the show, but you can send your donation that helps us save lives.
I want to thank you all for your services, and you are my heroes. And we commend you. And we here at Ask the Messengers haven't forgot about you. So I just want to thank y'all for y'all services and continue to help people out there who's looking for help. I thank you so much.
And one final thing.
You raised us.
Right. One final thing. If there's something that you would like to say to America, to our viewers and people who will see this, is there a word of encouragement or anything that you would like to just share as your final thoughts, your final whatever is there something you would like to share? Please feel free to do so now.
My final thoughts would be, I heard them talk, George and Eleanor talking about mental health. what I do is co-occurring, work with the co-occurring disorder, you know, and that if anybody is out there struggling, that them old dreams you had, see, I remember that dream I had as a teenager wanting to be a child psychiatrist. And today, come next February, I'll have my master's degree. And that during this process, that I want anybody that's struggling. I've seen a commercial today, and the lady said her son had died. And she said, don't be afraid to ask for help just because it's in your household and you don't want your neighbors to know that people in your house is using drugs and that they may kill themselves, right? So she said, reach out for the help you need for your loved ones. You know, be there for your loved ones because they're fighting for their life. That's all I got.
Thank you.
All right. Eleanor?
I just leave with this thought. I was thinking while we were speaking that we're better together. And that we as a whole, as a city, as a state, not only like Mr. Arnold was saying, are we fighting this COVID-19 virus, but we're fighting this drug virus, you know, and just like we survived that and we're living proof that we've survived that, we will also survive this. So stay strong. Those of us that are not able to attend face-to-face meetings, please reach out to our members that's not able to get a part. And we just stay strong and know that we'll get through this. This too shall pass.
Thank you.
Mr. Arnold?
I guess if I was to say anything, I'm hoping that at the end of this, that people take a different look at public health and public health services. You know, there's a lot of individuals that is working during this pandemic that people were arguing to give minimum wage. They didn't want to give them a raise. And a lot of these people outside of the hospital that's contributing, they had to they're giving them $2 extra to risk their life, but you wouldn't give them $2 to make a livable wage. And that's across the board for all these individuals at the grocery store, the recovery coach, the monitors, that recovery coach is not certified, but that's working there, that individual in the transitional house, all these individuals that are making just minimum wage, just barely making it. You know, I'm hoping that society takes a look at services and at these people and treat them and give them what they're worth. Because when the chips is down, you need me today just as much as you needed me yesterday. I just wasn't appreciated. That's about it.
That's awesome.
Okay, again, thank all of y'all for sharing y'all stories with us here on Ask the Messenger. I would like to thank y'all so much.